Hi, good morning. How is everyone doing? How is our day going? Yeah, it's a blessed day. So today, I want to be talking about kidney since we supposed to know about our kidney, the function, how to manage our kidney, things to do, things to eat, so that we won't put ourselves in danger. Thank you. So, why are the kidney important? So, your kidney, the main work of your kidney is to remove waste and extra fluid from your body. Your kidney also remove acid that is produced by the cell of the body and maintain healthy balance of water, salts, minerals such as sodium, calcium, phosphorus, potassium in your blood. So without this balance, nerves, muscles, and all the tissue in the body will not work normally. Yes. So your kidney hormone that help control your blood pressure, make red blood cell, keep your bones strong and healthy. So how do my kidney work? Yeah, each kidney is made up of about millions filtering units called nephrons. Each nephron includes filter called glomerulus and a tubule. The nephron work in two-step process. The glomerulus filter your blood and the tubule return needed substances to your blood to remove waste. Right? Kidney come in pairs. Yeah, we have two kidneys, but we only need one kidney to live. So, why most people have two kidneys? We only need one kidney, one functioning kidney to live a healthy life. Whether you have only one kidney or one functioning kidney, you may need to follow strict precaution when looking for your renal health. So some of the reason you may have one functioning one kidney include being born with one kidney. Yes, some people were born with one kidney, while many people have to. Having one removed due to injury or disease, maybe you have maybe also donated to someone. You might have two, but one is functioning. Your kidney pumps more than 50 gallons of blood daily. Your kidney may be small, but they do quite a bit of work. The kidney are responsible for removing waste, like I said before, excess fluid from the body by filtering them out from your blood. Your kidney filters about 52 gallons. That's like 200 liters of blood throughout a given day. They also regulate body salt content. Along with filtering all out waste from your blood, your kidney helps to regulate body's sodium level. However, it is important to keep in mind that it is possible to take in more salt than your kidney can regulate, can remove, can safely remove from your body. So, why salt is essential for your body to function properly? Excess amount can be damaging your body, leading to heart disease, stroke, even kidney failure. So, like I said, things to avoid. It's good to eat salt, but not in excess. Excess salt, excess taking of salt can damage your body. It can lead to heart disease, stroke, even kidney failure. So let's talk about some kidney conditions because of all the vital function of kidney perform and it in the encounter. The kidney are susceptible to various problems, which are some of this condition include chronic kidney disease, kidney failure, kidney stone, glomerulonephritis, acute nephritis, polycystic kidney disease, urinary tract infection, cholestasis, acidosis, uremia, hydronephrosis, poliomyelitis, kidney cyst, nephrotic syndrome, azotemia. So, and much more. Symptoms of kidney problems. Kidney condition can range from one symptoms to another, but some common ones include trouble sleeping, fatigue, inability to concentrate, dry and itchy skin, increase and or decrease in urination, blood in urine, foamy urine, puffiness around the eye, foot and ankle swelling, reduced appetite, and muscle cramps. If you notice any of these symptoms, please contact your doctor or visit your hospital. Tips on healthy kidney. So, like I said before, avoid extra salt. Salt is good, but in minimal. Don't let it be too much. Eating a lot of salty food can disrupt the balance of mineral in the blood. This can make it harder for kidney to work properly. Try swapping out processing food, which usually have a lot of added salt, for whole food such as fresh food and vegetable, lean cut of meat, nuts, and also do exercise. High blood pressure is a known risk factor for chronic kidney disease. Regular exercise, even for just 20 minutes in a day, can help reduce blood pressure. Stay hydrated. Drink water always. Drinking plenty of water helps the kidney to perform one of their most function, removing toxins. Use medication with caution. Don't be self-medicated. If doctor is not prescribing anything for you, don't take it. Don't think, oh, this person is taking this, or when this person is having a headache, it took diclofenac. Oh, let me go and take it too. No, please don't. Regular taking certain over-the-counter medications such as non-steroidal anti-inflammatory drug can cause kidney damage over time. Occasionally, taking them is fine. Occasionally, it's fine, but work with your doctor, please, to find alternative if you have conditions that require managing pain, such as arthritis. Know the risk factor. Several things can increase the risk of developing kidney condition. Make sure regularly you have your kidney function tested. If you have diabetes, if you are obese, or have high blood pressure, or even if you have family history of kidney disease. So try and be testing yourself, regular checkup. Even if you don't have any of these risk factors, it's always good to do checkup. Always check your body, it's good. So what are the type of kidney function tests that we can do? So there are many kidney function tests, but let me mention a few. You may have blood tests for kidney function such as blood urea nitrogen, BUN. It measures nitrogen made from protein breakdown in the blood. Also estimated GFR. It calculates filtration rate based on your protein level, age, gender, size, and race. Serum creatinine too. looks for buildup of creatinine, a waste product from muscle tissue breakdown. Your healthcare provider may also use 24 hours urine test, including microalbuminuria, looks for a specific protein called albumin. Also, urine analysis evaluates your urine for blood protein absorption. If you look at one of my videos that I did in the past, I explain details about urine analysis and how to do it, what to look out for, the function of each parameters we have in the urine analysis. So, what happens during a kidney urine test? You complete a 24 hours urine test at home. For a 24-hour urine test, your provider will give you a container to collect your urine on the day of the test. You urinate in the toilet as usual after you wake up first. So for the rest of the day, you urinate inside the container that they give you. On the day 2, you urinate in the container when you wake up to complete the 24 hours before you drop the sample in the lab for testing. So for the kidney blood test, the technician will collect small amount of sample. In my past videos, I show you guys how the process of taking sample in phleb. So phlebotomy will take your blood sample for the lab scientist to run. What do the results of my kidney function test mean? Kidney function test results can tell you whether your kidney are functioning typically or not. Most function tests look for 2 measurements, GFR, of less than 60 could indicate kidney disease. Urine albumin to creatinine ratio, UACR, of more than 30 milligrams per gram could be a warning sign of kidney disease. Treatment: antibiotics for kidney infection. Antibiotics are the first line of treatment for kidney infections. The drug is used, and the length of time of the treatment depends on your health and the bacteria found in your urine test. Symptoms of a kidney infection often begin to clear up within few days of treatment, but you might need to continue antibiotics for a week or longer. Finish taking the course of antibiotics even if you start feeling better, so that to complete the treatment, that is the best thing. For your provider might want you to have a repeat of urine culture test to make sure the infection has cleared. If the infection is still present, you will need to take another course of antibiotics. Hospitalization for severe kidney infection. If your kidney infection is severe, you might need to go to the hospital. Treatment might include antibiotics and fluid through your vein in your arm. How long you will stay in the hospital depend on how severe the infection is. Treatment of recurrent kidney infection. Underlying medical problem such as a mishapen urinary tract can cause you to have repeated kidney infections. In that case, you might be referred to a kidney specialist, nephrologist, or urinary surgeon, that is urologist. You might need surgery to repair a structural problem. Lifestyle and home remedies. To help you feel better while recovering from a kidney infection, you might apply it. Placing a heat pad on your belly, back or side to ease pain. Use pain medicine for fever or discomfort. Taking pain relief such as acetaminophen, Tylenol, and others. If you have chronic kidney disease, it is best to avoid or limit use of non-steroidal anti-inflammatory drugs such as ibuprofen, Motrin ID, Advil, and all. Stay hydrated. Avoid dehydration. Always stay hydrated. Drinking of fluid will help flush bacteria from the urinary tract. Avoid coffee and alcohol until your infection has cleared. Then they can worsen the feeling of needing to urinate. Chronic kidney disease. Chronic kidney disease can be diagnosed with blood and urine tests. In many cases, chronic kidney disease is only found when a routine blood or urine test you have for another problem show that your kidney may not be working normally. Who should be tested for chronic kidney disease? Say general physician if you have persistent symptoms of chronic kidney disease such as weight loss or poor appetite, swollen ankle, feet and heart edema, shortness of breath, tiredness, blood in your pee, in your urine, peeing more than usual, particularly at night. The general physician can look for possible causes and arrange tests if necessary. Because chronic kidney disease often has no symptoms in the early stage, some people at the higher risk should be tested regularly. Regular testing is recommended if you have high blood pressure, if you are diabetic, if you have acute kidney injury, sudden damage to the kidney that causes them to stop working properly. Cardiovascular disease, condition that affect heart, arteries and veins, such as coronary heart disease or heart failure. Other conditions that can affect kidneys, such as kidney stone and enlarged prostate or lupus. A family history of advanced chronic kidney disease or an inherited kidney disease. Protein or blood in your urine where there is no cause. Children and young people with one working kidney should be treated regularly. You are also more likely to develop kidney disease if you are black or of South Asian origin. Sorry about that. So, people taking long-term medicine, it can affect their kidney, such as lithium, omeprazole, or non-steroidal anti-inflammatory drug, should be tested regularly. Talk to your general physician if you think you may need regular testing for kidney disease. So, test for chronic kidney disease. The main test for kidney disease is a blood test. The test measures the level of a waste product called creatinine in your blood. A doctor uses your blood results plus your age, size, and gender to calculate how many millimeters of waste your kidney should be able to filter in a minute. This calculation is known as your estimated glomerular filtration rate. Healthy kidneys should be able to filter more than 90 ml per minute. You may have chronic kidney disease if your rate is lower than this. Urine test. A urine test is also done to check the level of the substances called albumin and creatinine in your urine, known as the albumin creatinine ratio or ACR. Albumin creatinine ratio. Check your blood or protein in your urine alongside your EGFR. Like I said, the calculation estimation glomerular filtration rate. Urine tests can help give a more accurate picture of how well your kidneys are working. Other tests. Sometimes other tests are also used to assess the level of damage to your kidney. This may include an ultrasound scan, MRI scan, or CT scan to see what the kidney looks like and check where there are any blockages. A kidney biopsy. A small sample of kidney tissue is removed and the cells are examined under a microscope for a signs of damage. Test results and stages of chronic kidney disease. Your test can be used to determine how damaged your kidneys are. Known as the stage of chronic kidney disease. This can help your doctor to decide the best treatment for you and how often you should have the test to monitor your condition. Your EGFR, the estimation of glomerular filtration rate. The EGFR result is given as a stage from 1 to 5. So stage 1, GI. A normal EGFR above 90 ml per minute, but all the tests have detected sign of kidney damage. Stage 2, which is G2, slightly reduced EGFR of 60 to 89 ml per minute with other signs of kidney damage. Stage 3A, G3A, and EGFR of 45 to 59 ml per minute. Stage 3B, G3B, and EGFR of 30 to 44 ml per minute. Stage 4, G4, and EGFR of 15 to 29 ml per minute. Which stage 5, G5, is an EGFR below 15 ml per minute, meaning the kidney have lost almost all of their function. Your ACR result is given as a stage from 1 to 3. Stage 1, A1, and ACR of less than 3 mg per mole. A2, an ASR of 3 to 30 mg per mole. A3, an ASR of more than 30 mg per mole. For both EGFR and ACR, a higher stage indicates more severe kidney disease. There is no cure for chronic kidney disease, but treatments can help relieve the symptom and stop it getting worse. Sorry about that. So your treatments will depend on the stage of the CKD, chronic kidney disease. The treatments are lifestyle changes, To help you stay healthy and possible, you have to change your lifestyle. If you are the type that don't like to drink water, you have to stay hydrated, like I mentioned before. Drink enough water. If you are the type that smoke, you have to stop it. So, medicine to control associated problems such as high blood pressure and high cholesterol, you have to use the medicine. Dialysis. Dialysis is treatment to replicate some of the kidney's function which may be necessary in advanced, like the stage 5 of the chronic kidney disease. Kidney transplant. This may also be necessary in advanced stage 5 of the CKD. So, concerning the lifestyle changes, the following lifestyle measures are usually recommended for people with kidney disease. Stop smoking if you smoke. If you're having kidney disease, kidney problem, either chronic or not chronic, stop smoking if you smoke. Eat healthy, balanced diet. Restrict your salt intake to less than 6 grams a day. That is around 1 teaspoon. Do regular exercise. Aim to do at least 150 minutes a week. 150 minutes a week. Manage your alcohol intake. So you drink no more than recommended limit of 14 units of alcohol in a week. Lose weight. If you are overweight or obese, try to lose your weight. Avoid over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen, except when advised by a medical professional. This medicine can harm your kidney if you have kidney disease. So, medicine. There is no medicine specifically for chronic kidney disease, but for medicine can help to control many of the problems that cause the condition and the complications that can happen as a result of it. You may need to take medicine to treat or prevent the different problems caused by CKD. High blood pressure. Good control of blood pressure is vital to protect the kidneys. People with kidney disease usually aim to get their blood pressure down to below 140/90 mmHg. But you should aim to get it down below 130/80 if you also have diabetes. There are many types of blood pressure medicine, but medicine called angiotensin converting enzyme (ACE) inhibitors are often used. Examples include ramipril, enalapril, and lisinopril. Side effects of ACE inhibitors can include a persistent dry cough, dizziness, tiredness, or weakness, headache too. If the side effects of ACE inhibitors are particularly troublesome, you can be given a medicine called angiotensin 2 receptor blocker (ARB) instead. Diabetes or high ACR. If you have a type 2 diabetes or high albumin to creatinine ratio, you may be offered a type of medicine called SGLT2 inhibitors. such as dapagliflozin, as well as medicine for high blood pressure. Dapagliflozin helps to lower your blood sugar and can reduce damage to your kidney. You may also be given an additional medicine called finerenone to take with dapagliflozin. Finerenone works by blocking the action of certain hormones that can damage your kidneys. High cholesterol. People with CKD have high risk of cardiovascular disease, including heart attack and stroke. That is what happens when some people just say the person fell down and died. My dear, that might be underlying disease that is causing that. Maybe the person is not checking well, is not having proper medical checkup often, so it can happen. So this is because some of the kidney disease are the same as those for cardiovascular disease, including high pressure and high cholesterol. You may be prescribed medicine called statin to reduce your risk of developing cardiovascular disease. Examples include atorvastatin and simvastatin. Side effects of statin can include headaches, feeling sick, constipation or diarrhea, muscle and joint pain, high potassium level. People with CKD can develop high potassium level in their blood called hyperkalemia because of their kidneys do not work properly. Hyperkalemia can cause muscle weakness, stiffness, tiredness, and if it becomes severe, it can cause an irregular heartbeat, arrhythmia, which can lead to heart attack. If you have CKD, it is important to avoid taking potassium supplements and some medications used to treat high blood pressure and heart failure because it can make your potassium level too high. Talk to your GP, your general physician, about the medicine to take if you are worried. A medicine called sodium zirconium cyclosilicate can be used to treat hyperkalemia in adults, but only if it is used in emergency care for acute life-threatening kalemia alongside standard care. People with hyperkalemia that does not get better, called persistent CKD, who also have stage 3 CKD, stage 3B to 5, or heart failure, should only take sodium zirconium cyclosilicate if they have serum potassium level of at least 6.0 millimole per liter, and not also taking a certain amount of renin, angiotensin, aldosterone system RAS inhibitors because of hyperkalemia and are not on dialysis. You should also stop taking sodium zirconium cyclosilicate if RAS inhibitors are no longer suited for you. Water retention. You may get swelling in your ankle, feet, and if you have kidney disease. So this is because your kidneys are not as effective at removing fluid from your blood, causing it to build up in body tissue. also edema. You may be advised to reduce your daily salt and fluid intake, including fluid in food such as soup and yogurt. You can reduce to help reduce the swelling. In some cases, you may also be given diuretics tablets to help you pee more, such as furosemide. Furosemide. So, side effects of diuretic can include dehydration and reduce level of sodium and potassium in blood. Anemia. Many people with advanced stage of CKD develop anemia, which is lack of red blood cells. Symptoms of anemia include tiredness, lack of energy, shortness of breath, and pounding, fluttering, or irregular heartbeat palpitations. If you have anemia, you may be given injection of a medicine called erythropoietin. This is hormone that help your body to produce more red blood cells. If you have an iron deficiency as well, iron supplements may also be recommended. If you have anemia but do not have iron deficiency, you may be given a medicine called rosuvastatin. This medicine helps your body to produce more red blood cells and come as tablets. Bone problems. If your kidney are severely damaged, you can get a build-up of phosphate in your body because your kidney cannot get rid of it. Along with calcium, phosphate is important for maintaining healthy bones. But if your phosphate level rises too much, it can upset the balance of calcium in your body and lead to thinning of the bones. You may also be advised to limit the amount of food you eat which are high in phosphate, such as red meat, dairy products, eggs, and fish. If this does not lower your phosphate level enough, you may be given medicine called phosphate binders. Commonly used medicine include calcium acetate and calcium carbonate. Some people with CKD are also have low level of vitamin D, which is necessary for healthy bones. If you are low in vitamin D, you may be given a supplement called calciferol or L-gocalciferol to boost your vitamin D level. Glomerulonephritis. Kidney disease can be caused by inflammation of the filters inside the kidneys, known as glomerulonephritis. In some cases, this happens as a result of immune system mistakenly attacking the kidneys. If a kidney biopsy finds this is the cause of your kidney problem, you may be prescribed medicine to reduce the activities of your immune system, such as a steroid or a medicine called cyclophosphamide. Improving muscle strength. If you are having a bad flare-up and are unable to exercise, you may be offered electrical stimulation to make your muscles stronger. This is where electrodes are placed on your skin as a small electrical impulse are sent to the weak muscle, usually in your arms and legs. So, dialysis. For a small proportion of people with CKD, the kidneys will eventually stop working. This usually happens gradually. So there should be time to plan the next stage of your treatment. One of the options when CKD reaches the stage is dialysis. This is a method of removing waste products and excess fluid from the blood. There are two main types of dialysis: hemodialysis and peritoneal dialysis. So, hemodialysis, this involves diverting blood into an external machine where it is filtered before being returned to the body. While peritoneal dialysis, this involves pumping dialysis fluid into space inside your tummy to draw out waste products from the blood as they pass through the vessel lining inside of your tummy. So hemodialysis is usually done about 3 times a week, either at hospital or at home. Peritoneal dialysis is normally done at home several times a day or overnight. If you don't have a kidney transplant, treatment with dialysis will usually need to be lifelong. Talk to your doctor about the pros and cons of each type of dialysis, which type you would prefer if your kidney function become severely reduced. Kidney transplant. An alternative to dialysis for people with severely reduced kidney function is a kidney transplant. This is often the most effective treatment for advanced kidney disease, but it involves major surgery and taking medicine immunosuppressants for the rest of your life to stop your body attacking the donor organ. You can live with one kidney, which means donor kidney can come from living or recently deceased donors. But there is still shortage of donors, and you could wait months or years for a transplant. You may need to have dialysis while you wait for a transplant. Survival rates for kidney transplants are very good. About 90% of transplants still function after 5 years, and many work usefully after 10 years or more. Supportive treatment. You will be offered a supportive treatment if you decide not to have dialysis or transplant for a kidney failure, or they are not suitable for you. This could also call palliative or conservative care. The aim is to treat and control the symptoms of kidney failure. It includes medical, physiological, and practical care for both the person with the kidney failure and their family, including discussion about about how you feel and planning for the end of life. Many people choose supportive treatment because they are unlikely to benefit from or have a good quality of life with treatment. And those who don't want to go through the inconvenience of treatment with dialysis, or those who advise against dialysis because they have other serious illness and the negative aspects of treatment outweighs likely the benefits. Having been on dialysis but have decided to stop the treatment, or been treated with dialysis but have no serious illness such as severe heart disease or stroke that will shorten their life. Supportive care through kidney unit can still help to live for some time with a good quality of life. Doctor and nurses will make sure you receive medicine to protect your remaining kidney function for as long as possible, medicine to treat other symptoms of kidney failure, such as feeling out of breath, anemia, loss of appetite, or itchy skin, help to plan your home and money affairs. Bereavement support for your family. Many people with chronic kidney disease are able to live long life without being unduly affected by the condition, although it's not possible to repair damage that has already happened to your kidneys. CKD will not necessarily get worse. CKD only reaches an advanced stage in a small proportion of people. But even if your condition is mild, it is important to take good care of yourself to help it stop to help it stop getting worse or reduce the risk of other health problems such as cardiovascular disease. Looking after yourself. Take your medicine. It's very important that you take every prescribed medicine, even if you don't feel unwell. Some medicine are designed to prevent serious problems from happening in the future. It is also useful to read the information leaflets that come with the medicine about possible interaction with other medicine or supplements. Speak to your care team if you have any concern about the medicine you are taking or if you are experiencing any side effects. Check with your doctor or pharmacist if you plan to take any over the counter medicine such as painkiller or nutritional supplements. This can sometimes affect your kidney or interfere with your prescribed medicine. Having a healthy diet. A healthy and balanced diet can help improve your general health and reduce your risk of developing further problems. A balanced diet should include plenty of fruits and vegetables. Aim for at least 5 portions a day. Meals that include starchy food such as potatoes, whole grains bread, rice and pasta. Some dairy or dairy alternatives. Some beans or pulses, fish, egg or meat as a source of protein. Low level of saturated fat, salt and sugar. You may also be given advice on dietary changes that can specifically help with kidney disease, such as limiting amounts of potassium and phosphate in your diet. Exercise regularly. Regular physical activities can also help to improve your general health. Do not be scared to exercise. Exercise regularly. Regular physical activities can also help improve your general health. Do not be scared to exercise. Exercise is good for everyone with kidney disease, however severe. Not only will it boost your energy, it helps you sleep, strengthen your bones, ward off depression, and keep you fit. It may also reduce your risk of problems such as heart disease. If you have mild to moderate CKD, your ability to exercise should not be reduced. You should be able to exercise as often and as vigorously as someone at the same age as you with healthy kidneys. If your condition is more advanced as you are already on dialysis, your ability to exercise is likely to reduce and you may become breathless or tired more quickly. But exercise is so beneficial. Start slowly and build up gradually. Check with your doctors before beginning a new exercise program. Stop smoking. If you smoke, stopping smoking can improve your overall health and reduce your risk of many other health problems. Speak to a GP, general physician, or NHS stop smoking service if you need help quitting. They can provide support and, if necessary, prescribe stop smoking treatments. Limit your alcohol consumption. You may still be able to drink alcohol if you have kidney disease, but it is advisable not to exceed the recommended limit of more than 14 alcohol units a week. Speak to your GP or care team if you find it difficult to cut down the amount of alcohol you drink. Also get vaccinated. Kidney disease can put a significant strain on your body where you are more vulnerable to infections. Everyone with the condition is encouraged to have annual flu jab, the one of pneumococcal vaccination. You can get this vaccination at your GP surgery or local pharmacy that offer vaccination services. Regular review and monitoring. You will have a regular contact with your care team to monitor your condition. These appointments may involve talking about your symptoms, such as whether they are affecting your normal activities or getting worse. A discussion about your medicine, including whether you are experiencing any side effects, tests to monitor your kidney function and general health. It is also a good opportunity to ask any question you have, always any other issue you would like to discuss with your care team. You may also want to help monitor your condition at home. For example, by using home blood pressure monitor. Contact your GP or healthcare team if your symptoms are getting worse or you develop new symptoms. Relationship and support. Coming to terms with conditions such as CKD can put a strain on you and your family and your friends. It can be difficult to talk to people about your condition, even if they are close to you. Learning about CKD may help you and your family understand what to expect and to feel more in control of the illness. Instead of feeling that your lives are now dominated by CKD and its treatment, be open about how you feel and let your family and friends know what they can do to help. Be open about how you feel and let your family and friends know what they can do to help. However, do not be shy. Do not feel shy about telling them that you need some time to yourself. If that is what you need, get support. Your GP or healthcare team can reassure you if you have questions about your CKD, or you may find it helpful to talk to a trained counselor, psychologist, or specialist telephone line operator. Your GP surgery will have information on this. Some people find it helpful to talk to one another, people with CKD, at a local support group or through an internet chat room. Sex and pregnancy. Having CKD can affect our sexual relationship. Some couples becomes closer after a diagnosis of CKD, while others find their loved ones are affected by worries about how they will cope with the illness. Both men and women may have issues about body image and self-esteem, and this can affect a relationship. Problems such as erectile dysfunction and reduced sex drive are also fairly common in people with CKD. Try to share your feelings with your partner. If you have problems with sex that do not get better with time, speak to your care team. Treatment and support is available. Pregnancy. If you have mid to moderate kidney disease, it is unlikely your condition or its treatment will affect your chances of having children. More advanced kidney disease may affect women's period or reduce a men's sperm count, which can make it more difficult to get pregnant. Although this does not mean you will not be able to have a child, it is more important to use contraception if you do not want pregnant. If you do want to try for a baby, it is good idea to speak to your healthcare team for advice first. There may be risks to mother and baby, and changes to your treatment or checkup may be necessary. Work finances and benefits. Can I continue working? If you feel well enough, you can keep working for as long as you feel able. Talk to your employer as soon as you feel your condition is affecting your ability to do your job, so you can find a solution that suits both of you. For example, it may be possible for you to work part-time. The Equality Act 2010 requires employer to make reasonable adjustments to help a person with a disability. This might, where possible, include changing or modifying tasks, altering work patterns, installing special equipment, allowing time off to attend appointments, or helping with travel to work. What if I can no longer work? If you have to stop work or work part-time because of CKD, you may find it hard to cope financially. You may be entitled to one or more following types of financial support. If you have a job but cannot work because of your illness, you are entitled to statutory sick pay for your employer for up to 28 weeks. If you do not have a job and cannot work because of your illness, you may be entitled to employer and support allowances. If you are age 65 or over, you may be able to get attendance allowance. If you are caring for someone with CKD, you may be entitled to carers allowance. You may be eligible for other benefits if you have children living at a home of a low household income. Holiday and insurance. If you have mild CKD or you have had a transplant, going on holiday should not pose additional health problems, whether you are staying in the UK or abroad. Speak to your care team before you travel and make sure you take your medicine with you to cover your trip and some backup medicine in case you end up needing to stay away from home longer than planned. If you are on dialysis, you can still enjoy holidays. If you book your treatment before you go away, if you want to travel to another part of the country, discuss your plans with your renal unit as early as you can go so they can arrange dialysis at a unit close to your destination. In many parts of the country, the lack of facility restricts the freedom of patients to travel. Thank you for watching my video. I really appreciate it. Check for more information about health. Take good care of yourself. Drink water, exercise, and try and eat balanced diet. Take your health serious. Have a good and blessed day. Bye.